Hello and welcome everyone in another episode of Big Interviews. Today is the day to welcome another achiever, a winner in the DAMS studios. I'm referring to the wonderful person here with me, Dr. Madhu N. He's scored wonderfully in the AIIMS May 2017 postgraduate medical entrance exam with a rank of 45. Great performance, Dr. Madhu. Congratulations on your wonderful performance. Kindly share your heart with us. How are you feeling?
I feel very happy to have got into AIIMS. That's my dream institute to my medicine. I would really like to thank DAMS. Without DAMS, I think I would have not cleared AIIMS exam. And I would also like to thank Dr. Sumay Sethi sir and Dr. Deepthi ma'am for providing me support and guidance to get into this AIIMS exam.
I think you are keeping it very modest, Dr. Madhu N. It was all your hard work that has come into play, and you have secured a rank of 45 in such a tough exam.
I would also like to thank all the DAMS faculty, teachers. Without their support, I would have not secured good rank at AIIMS.
That's so kind of you. Such kind words are always encouraging for us. I personally know that where you have come from, but I'm sure that my listeners and all my viewers would like to know that where and in which course you were enrolled with DAMS.
I did my MBBS from Mysore Medical College at Mysore, and I was enrolled in regular course, and I also attended DAMS Niman's crash course.
So is that a satellite center, if I'm not wrong?
Yes, I have done satellite DAMS.
How was the experience in the satellite course?
It's very nice. The study environment is very good at Mysore DAMS. If I get any doubts, the faculty were there, and I used to ask, type in the keyboard, and then I used to ask my doubts and clear then and there. So it was very helpful.
Well, that's great to know. As we all know, Dr. Madhu, that if you're preparing for a postgraduate medical entrance exam, be it the NEET or AIIMS or a PGI, and AIIMS in your case, as you have secured a wonderful rank, how did you prepare for such tough exam?
We had the same subjects what we had the particular day. Whenever one subject was covered, I used to go home and then revise the same subject again. Then I used to do my pre-class preparation, the next subject which was in the next week, and then I used to attend the class. Then if I have any doubts, I used to get cleared the doubts then and there. Then after that, I used to do a post-class revision also. I never used to give a gap of more than 7 days per subject, so that I can recall better and
you can hammer the more theoretical things in your brain.
Yes.
Well, that's wonderful to know. One important question that comes to our mind is about the time management. You see, you have a limited time when you're preparing for postgraduate medical entrance exam in India. How did you manage your time? And also, we would be happy to know if you tell us your method of study. Was it more selective or extensive?
I used to do selected subjects. For AIIMS, you might be knowing that medicine, OBG and PSM subjects, and are given more weightage. So you have to be thorough with second year subjects. On first year subjects have also been around 50% of weightage will be there. So you should be thorough with all these subjects, and as well as images. Images make most of the AIIMS exams. Around 60 to 70 images will be asked per exams, and it's a good scoring subject in that AIIMS exam.
Before the interview, Dr. Madhu, we were talking about the time management thing, and you said that you would revise or study a subject before the class, and when the class would fall, you would be ready with your preparation. Can you just elaborate on how this was helping you?
It used to give me less time on the subjects which I knew better, and I used to concentrate the more time on the subjects which I was not familiar with. So it helps a lot to get that orientation of how you should approach a subject, and you should study the subject which are given more weightage and more marks in the AIIMS.
Well, then I would say that the perfect mix of your success was a mix of selective study, extensive study, and more of revision.
Yes, and also when you're doing when you're approaching the AIIMS exam that day, you should be the exam is for 3 hours. like the last half an hour to 15 minutes is the major part that decides whether you get into AIIMS or not. If you get those questions correct, then you will get a better rank than almost all like toppers have done.
Well, these are really wonderful inputs that you are giving us. Let me ask you a straight question. How was DAMS useful in your preparation?
Like I would say everyone join DAMS as soon as from third year or final year. That will help you a lot. It will get first oriented on how to approach study a subject. Then after that, you can plan. During my in my college, the internship was very hectic, and we couldn't concentrate much on preparation. So if your internship is very hectic, it doesn't matter. You can always start after internship also, but it's better to start as early as possible.
That's very nice to know. And let me remind my viewers, let me remind my listeners here, I'm talking to Dr. Madhu and rank 45 in AIIMS May 2017 postgraduate medical entrance exam. Dr. Madhu, you would agree that DAMS is quite active on the Facebook medium. We have our own DAMS exclusive club. What is your comment on that?
DAMS exclusive club is very helpful. Whenever when you are reading some subjects, suddenly you get any doubt, so that you can post it in the Facebook, and the same day the faculty will answer the questions. So it really helps a lot. And the questions posted by other students also, we'll get to know more questions in less time. So just browse it at the night, every day. So you'll just be oriented, and also the faculty will post all the updates, recent guidelines, changes. So it really helps a lot.
So it practically leaves no room for controversial questions or confusions.
Yes, yes.
That's wonderful to know. In the earlier question I asked you, you have mentioned that there were quite of visual questions that come in AIIMS exam. And I would like to tell my viewers here that DAMS conducts a DVT session every year in the Talkatore Stadium, New Delhi. Also the same is telecasted live in the DAMS studio as well. What is your comment? What is your take on this DVT session?
DVT session, the discussion as well as the images, what we see, the same thing will come in the AIIMS exam. So it's if you're not attended, then you will really miss the major part of the AIIMS, that is the images. So you have to attend the DVT session. It's really useful.
That's very nice to know. And let me just give a trivia here that this 2016 DVT session, we have enrolled ourselves with Limca Book of Records, and we are hopeful to come out with a wonderful answer from them. Now, taking my discussion to the next level, we have various publications at DAMS. We have, with that I'm referring to the CRS, that is the Comprehensive Review Series, and also the Last Looks, plus the Harrison's Notebook, etc. What is your opinion about it?
If you find the time, after reading the notes, just review the books, whichever the selected topics is more important. Do as many MCQs as possible. That really helps a lot, because after all it's the MCQs that fetches you a good rank. So and also the Last Look Harrison's has given many more updates. So it not go through again the main book of the Harrison's. So it's really good.
So what I can gather is that you're suggesting that you should go through DAMS notes first, and if time permits, you can refer to the textbooks also.
Yes.
That's wonderful to know. And let me also add on something here, that all the publications at DAMS are based on the standard textbooks that are prescribed in the medical schools in India. Let me ask you about the evaluation system that we have at DAMS. With this, I'm referring to the subject-wise test and the various grand tests we take, and also the revision test which is available to students. How did this evaluation system help you?
DAMS evaluation, whatever rank you get, your rank will be near to that rank in the main exams. So every month you will be having the subject-wise test. So what I suggest is that you give the subject-wise test then and there, so that you will see your mistakes as well as review it and then correct it for the next upcoming exams. So it's good that you get oriented to the real time exams. It's really good.
That's wonderful to know, and let me tell my viewers, we are telecasting big interview here with Dr. Madhu and Rank 45 AIIMS May 2017 Postgraduate Medical Entrance Exam. Dr. Madhu, just share with us that how did you find yourself, converting into a champion or a winner under the able guidance of DAMS faculty?
I would have not achieved this rank without DAMS. I'm really thankful to DAMS, like, for providing me an opportunity to succeed in my life. It's my dream to study at AIIMS. It's really been very hard work through this part. So I'm very happy to got into AIIMS.
Can you throw some light on what changes did you bring in yourself, to strive so wonderfully, and how the DAMS faculty would tell you small things, which help you to change into a wonderful champion?
The first thing is never give up. Suppose you fail in any exams, like, just never give up. Try again. You will succeed. Some other time you will succeed. And the luck also matters in AIIMS exam. So everything matters. All your hard work, and like in your dreams also, the AIIMS exam should be there. Then only you'll be at AIIMS.
Did the faculty at DAMS tell you some small things, which would bring, drastic changes in your preparation?
Yes, the faculty used to give the major updates and the questions which would appear on the real exams, and they will also post a few MCQs type, and they will also clear our doubts on the major questions which was asked in the exams, recent exams. So it was really helpful.
And it's really wonderful to know from the topper himself. I'm talking to Dr. Madhu in Rank 45 in AIIMS May 2017 Postgraduate Medical Entrance Exam. Let me ask you quickly here, Dr. Madhu, which faculties influenced you most in DAMS?
I would not like to specifically point at anyone. Like, all are good, all are the best teachers. They are at DAMS, so I'm thankful to them.
That's too modest of you. I would again say that it is all your hard work that has brought you wonders and made us proud as well. And as you have already mentioned that you opted for MD Medicine in AIIMS?
Yes, MD Medicine at AIIMS.
I will wish you all the best for for the future to come. And before we wind up this conversation, any message for your juniors you would like to say?
I will tell all my juniors to join DAMS as early as possible, and early to start is the early to succeed. So you have to be good at what you do, no matter anything it might be. Just bring out your own self. You'll succeed in life.
Those are very, very nice words, very motivating words. Thank you very much. I think it's time to wind up as Dr. Madhu has to catch a flight back home. And once again, formally, I thank you, Dr. Madhu, in Rank 45 AIIMS May 2017 Postgraduate Medical Entrance Exam. We wish you all the best in life.
Thank you very much.